Hello, everyone. It's Dr. Toya, and I am back with another episode of the Black Doctor Spotlight. And I have a very special guest with me, Dr. Stanley-Christian. She is the medical director of Unity Maternal Fetal Medicine in Claremont, Florida. Dr. Stanley-Christian, welcome. I am so happy to have you. You know, I am biased to OBGYNs because I am one. So I'm a little special, a little extra because she's a fellow Caribbean sister like myself. So welcome.
Thank you, Dr. Toya. Thank you for having me on your program.
Oh, you're welcome. Before we get into your story and thing, I just want to let people know this is triple board certified OBGYN, maternal fetal medicine, and clinical geneticist. You hear that? Three board certifications. Okay. So this is an expert of all experts, right? I am very honored and excited to have you. Take us back. Why did you go into OBGYN in general?
So OBGYN in general happened when I was pregnant and not in medicine at the time. Medicine went way back when I was about 10 years old, I believe. My paternal grandmother was a midwife, but I had known that until a few years before my mom died in 2020. But I wanted to become a neurosurgeon, which is kind of weird, but I also wanted to become a teacher. Okay. And I was blessed with tens of toys, dolls. So in the study area, I would be teaching them with some old books, and then they would have a bandage or something. And I was playing office. So all of that really tied back to my childhood. And then as I went through school, sciences was interesting to me. Fast forward, medicine, everything, every program, every curriculum was charted towards this day. I took a brief detour for research medicine, work at what used to be SmithKline and French back in the day, hated it, and so segued into clinical medicine.
Gotcha.
Went to Yale, here I am.
Okay, you went to Yale for medical school or for undergrad?
I went to Yale for medical school. I went to the University of the West Indies, Mona, for undergrad. And then I went to University of Southampton for a master's in biochemical pharmacology. That's when I thought I was going into research medicine.
And then you're like, no, this isn't it. No. Okay.
Yeah.
But so then did, your OBGYN residency, what made you want to go into MFM or maternal fetal medicine?
Well, I did not like GYN. I only did it because I had to get board certified.
Right.
And as soon as I could drop it, I did.
Gotcha.
Curiously enough, I loved gyn-oncology. And flirted with a fellowship at MD Anderson for a summer, and then realized that though I loved the surgery and I loved the acuity, I could not deal with the long-term psychological consequences that came with taking care of even patients who were as old as I was when I was doing that. I think that was what did it for me. And so that left at the time reproductive endocrinology and immunology. That wasn't happening. And maternal fetal medicine, which is where I am today.
Got it. Okay. And then for people who don't know, what exactly is maternal fetal medicine?
So that is a specialty where we deal with complicated high-risk pregnancies, maternal and fetal. It encompasses, I think, the right kind of integrative medicine because there are medical complications such as lupus, diabetes, hypertension, for which a lot of women don't realize that they had until they became pregnant.
Right.
And so the medical management of that, seizure disorders, I do that. I actually love it. So I won't farm off to the subspecialties. Like if you have a blood problem, I won't necessarily send you to hematology right away. So there is that. And then the fetal part The ultrasounds give you the opportunity to see your second patient who you just can't evaluate. So the ultrasound machine is the stethoscope and the well-being exam and the gestational, the pediatric, but in utero portion of things.
Right.
And so that was like a nice combination. And then I was beginning to see that there were genetic syndromes kind of creeping up that I was diagnosing in utero. I was like, oh, so I went and I got specialized. I got boarded in clinical genetics.
Good. Wow. And that's really good because some places, the place I worked, we had a whole genetics team, but a lot of places don't have that. So it is really amazing that you can provide that service to your patients, because it's one thing to say, well, hey, you have this risk, and then there's nobody to really counsel you about what the next step is, what to expect, and things like that. So that's really amazing that they get all of that when they come to see you. Yeah.
Yes. Yeah. And I try to make sure that when my ladies leave, even if I don't have a complete plan, we sort of have a next steps plan to transition, to bridge over to other things.
Gotcha. So is it just that other regular OBGYNs, well, I don't consider myself a regular OBGYN, but non-specialized OBGYNs like myself, are you referral based only, or kind of patients say, I have this concern, I know I'm high risk, or I'm not getting the care that I need, I want to see a specialist? Can they reach out to you on their own to be seen and get these things evaluated?
Absolutely. The training that we were exposed to was you go through a channel system of sorts. You go to the OB, and then it was only then that you got invited to see an MFM. I think medicine is just kind of evolving. It's not the way it used to be when we even first started. Now that I've opened my own brick and mortar office, I will see a patient. The only thing is I don't deliver.
Right.
So there is going to be an eventual requirement that care is established with an OBGYN that is comfortable co-managing and delivering, because I used to love to do deliveries, but I think for me, it's better to give, so you guys can catch a baby. You guys can probably do it better than I can, but to have a baby to catch is more important to me than catching the baby.
Right. Yes, and I mean, it is a numbers game as well, right? You need to have the volume to keep up. It's not one of those things, it's a skill. And just like anything else, a skill needs to be honed. You need practice and things like that. So definitely understand and commend you that you realize this is where my expertise is. I don't need to be doing everything. That I feel like the best of both worlds. That you can co-manage. So is it that you will manage a patient alone up to a certain point, or is it always in conjunction with a general OBGYN?
For the best interest of the patient should have somebody who can take care of the routine pregnancy aspects. So if I do manage alone, then when it's time to deliver, who's going to do that? Right. And I don't at this point yet have an arrangement for that. But if a patient were to reach out to me as they're doing, just had one that had no prenatal care, and she got on my schedule. I did what needed to be done. I made sure that she knew how important it was for her to get tapped in. And then I contacted 2 places that I know that would probably take her this late in the game.
Right.
And tapped her into that. Unfortunately, I won't manage a patient alone unless they have somebody else to kind of help them with the routine aspect of the pregnancy.
Yeah, and that's really important, because there are things that patients, sometimes I see when they come in for their routine OBGYN appointments, they're like, is that it? But these things are important, like those little things, and you have so much to deal with and manage. You really want to make sure that the whole patient and the whole pregnancy gets addressed. So I think that the arrangement you have right now is perfect. The directory by default, my whole mission is really to serve the Black community. And we'll be remiss of us not to talk about the rates of Black maternal mortality in this country that just keep going up. Say that there was one thing or a couple main things that Black women can do to kind of decrease the chances of them having complications that need to see you. Like, are there things that you see that you're like, oh, this could have been prevented if ... Because we know that there are external things that we cannot control, the racism, et cetera, right? So what can we do as Black women to help ourselves in the system that doesn't necessarily want to help us?
So the first thing, self-advocacy is not a bad thing. There is a way to advocate for self that's mindful, that's respectful, but proactive.
Yeah.
And if a woman feels that they're not being listened to, there is no shame in saying, excuse me, I don't feel as though you're listening to me. And if that interplay between human being and human being, if having said that in a respectful way, because, you know, sometimes we come in with some drama.
Right.
And it's hard to leave that drama at the door and interface with somebody who's never met you before. And a lot of people project when they're angry. It's a natural instinct. Right. And it's also a natural instinct for the receiver to flex and put up barriers.
Right.
So the best advice that I could say is this. You have a concern, have a conversation with yourself before you even get into the room. You know, practice. If you get that bad phone call before you go into the doctor's office, right, try and put that aside and engage with whoever you are as they are. They're meeting you for the first time. Speak your piece, speak your concerns. Don't be afraid to. I'm afraid that X, Y, and Z. And if you feel like you're getting blown off, pause and go, excuse me, I don't think you've heard me. Right. I don't feel like I'm being listened to. Now, if you've done all that, honey, second opinion, you know, nothing dictates that you have to stay there, even if it's free care, because guess what? There are other options. Yeah. But as human beings, and as women, we need to be heard. And the maternal instinct is no small thing. Right. Sometimes a woman knows, she don't know why, she don't know how, but she knows. And so it's important that whoever's taking care of her actively listens. Yes. Oh, that's a good one. Active listening. Because sometimes you go in and you can tell the person is hearing you, they're not really listening, right? And I like what you said about the intuition. I hear people say it all the time, I know my body, like I know something is wrong. And it's one thing to have that knowledge or that feeling and not really know why. And even if it is quote unquote nothing, meaning there's not a medical thing going on, having somebody that respects you enough to take the time to explain and to address your concerns, to investigate, to make sure it really is nothing is really, really important. And that's where the self-advocacy comes in, right? Yes. So yes. If you bring this concern, they say, oh, that's nothing. Well, there needs to be steps to get to that, right? So you can investigate, you can counsel, you can take the time to make sure it's addressed properly, and then reassure her, okay, well, this is nothing, this is normal, because we know pregnancy can be rough. It can be at baseline. I call pregnancy the ultimate stress test on a woman's body. Yes. If you're going to have hypertension, it's going to show up. You might not have it now, you might not have it after the pregnancy, right? But when you're 50, you're going to have it. Right. Diabetes, same thing. Liver problems, that cholestasis. Yeah, girl, it's an ultimate stress test. Yeah. Yeah, it is. Trust me, I know. Yeah. It's a lot.
All
I'm
right.
glad I didn't have my child when I was in med school. I'm
Oh,
glad I had him before I started med school because
yeah. But it's definitely a young woman's game. I don't know. Yeah. So, what would be, just in general, one thing that you wish patients knew about your practice in particular? One thing that you just want to get out there?
every person is their own story.
Mhm.
So even though as doctors we have algorithms,
Mhm.
we practice individualized care.
Mhm.
We're attentive, the entire team. We're attentive, we're supportive, we're lovingly straightforward. Sometimes we have to give difficult news.
Yeah.
Sometimes we don't want to hear some truths, but if there's a thing that needs to be said, it will be said in a very respectful and loving way.
Mhm.
We try to be thoughtfully consistent, and we are always strategically intuitive. So if there is a particular problem, and trust me, in MFM, we see so many different stations of some weirdness.
Yeah.
If I can't give you an answer in that moment, which happens and it's
Mhm.
okay, I do promise that I'm going to research to the best of my ability
Yeah.
to figure out what the issue is.
You definitely have the training to do proper research and figure it out.
Yeah.
So,
And
yeah.
sometimes we just don't know. And sometimes it's okay to say,
Mhm.
we don't know.
Yeah.
However, we still have to formulate a plan. So
Mhm.
we can either dwell in the labeling,
Right.
or we can move forward in the whatever this thing is, how we're going to move forward to monitor you and the baby.
Right. Okay. I ask everybody that I interview, what does it mean to you to be a Black physician, a Black OBGYN, MFM, and clinical geneticist?
My answer is going to sound a little strange because, from the Caribbean, it's
Mhm.
not, I mean, it's different because, for example,
Mhm.
growing up in Jamaica,
Mhm.
color, I don't want to say color wasn't a thing. I mean, it wasn't in our forefront all the time.
Right.
You turned on the TV, you saw Black people all the
Right.
time. We have had Black prime ministers, we've had Black women prime ministers
Right.
already. So my mindset is a little different
Mhm.
till I came here.
Right.
So I am mindful that it is a responsibility, but that's no different than being responsible as a physician if I were in my own country.
Right.
We do have a responsibility to be mindful as human beings, but I also do see the pride
Mhm.
when patients come in and they're like, and you see that, and it humbles me, and it reinforces for me that this is probably why I'm here. Did I at the time think, oh, I'm going to be the model of Black doctors? No.
Right.
But as I see the grandmas coming with their grandchildren who are pregnant, and I feel the energy of the elders
Mhm.
giving homage to the accomplishment, you can't help but have the hands on the back of your hair, the hair on the back of your hands stand up. You know what I mean? It touches a part of that soul and that heart, and it gives you that love and honor and respect that sometimes is well needed.
Yeah.
That's what it means to me to be a physician, because I get it all places, but when you get that extra little special love from our
Yeah.
peeps, Lord girl, it make the heart just go and all your stress just go,
Yeah.
okay, I can do this again.
Yeah.
You know?
No,
Yeah.
well, you put it perfectly. That it describes how I have felt when you get that energy from your patients, just the pride and the love and the respect, and just knowing that you can make them comfortable just by existing.
Yes.
Right? Perfect. All right, so tell everyone, where can they find you? How do they utilize your services, even if it's to follow you online, anything like that?
Okay, so we have a brick and mortar office in Claremont, Florida, that's west of Orlando. So if you live in the Orlando, Ocoee, anywhere around there, if you don't mind traveling 30, 40 minutes,
Yeah.
come see us. I'm on most insurance panels. I also do standard alone ultrasound. Well, I don't want to say radiology, but if you just come in because you want an expert eye to look at your baby and make sure everything's okay, we're happy to take you. I am licensed in a few states, so I could probably offer telehealth if somebody has a question, something was said, they didn't understand. We are happy to do that as well. I'm on Facebook, Unity MFM. We have a website, unitymfm.com. And I'm pretty sure I have an Instagram and a LinkedIn account. Stay tuned.
It's on there. Yes.
It's somewhere in there. I'm new to the digital world, so
Right. No worries. We will provide all of your links and your handles and everything so that the people that need to find you will be able to find you.
yes, yes. And you can always message on Google Business. We do answer questions from there as well. So we'll
Perfect.
answer questions and we'll point the directions even if we don't see you. So,
Perfect.
and we do
Yes.
have a live human being answering the phone.
Nice. All right. And you can also find them on bydefault.com. She is a member of our Black Physician Directory, and we just want to provide a link, right? We want to give you the resources that you need to get the care that you deserve. Because, and something you said, I really like, you said when you come into an office, human to human, right? That is so often lost when we come in as Black patients, is that you're wondering if, does this person see me as human? And that's the least amount that we could expect, right? It's just to be seen and respected as human beings. So the goal of the directory is to connect you with physicians that at baseline see you as human because they see themselves in you, right? So Dr. Stanley-Christian, thank you so much for joining us. It was a pleasure. Is there anything else you would like to tell our viewers before we say goodbye?
Yes, thank you so much, Dr. Toya, for having me here. And I want to say that life has always kind of been uncertain, but it's nothing post-COVID that just makes everything seems exponentially huge. So I would say take a deep breath. I did do a live Facebook Live about uncertainty. That was actually my first one, so I'm not even sure I want people to so much look at that. But
information is all that matters. It's okay.
But when a thing or an information or something presents, just take a deep breath in and out, and just for as long as it takes to kind of get your mind calm. And then you're going to ask yourself, is this something that I can affect change or not, or I don't know? And that's when you seek the help. I have this thing, I don't know what it is. Who do I talk to? We're here for that. I try to do educational pieces on little things that we see on ultrasound that kind of go, I'm like, sometimes you don't have to do that. Just breathe and go, okay, what does this mean? Take a moment if you need to. That's one thing I would say, because it will lower your blood pressure.
Right. Right.
And it will make things look a lot better. And that's the one thing I would want for anybody out there listening, pregnant or not, including myself.
Yeah. Take your pause and then get the help that you need.
Yes,
Yeah.
absolutely.
Thank you so much again. And I will see you guys next time on another episode of the By Default Black Doctor Spotlight. Bye.
Bye. Thank you.
you.